On April 15, 2009, Virginia Hospital Center hosted a press conference to announce and celebrate the Center for Breast Health at Virginia Hospital Center as the first NAPBC accredited breast center in Virginia and Washington, D.C. It is also one of the first 23 centers nationwide to receive the esteemed new distinction known as the National Accreditation Program for Breast Centers.
No national organization heretofore had stepped up to the plate and said, you know, what's really going on out there in the breast center world for these patients? No one had established any standards or any survey process. And so about 4 years ago, we began to put together a group of multidisciplinary individuals to define what we thought were appropriate standards. So we became a reality as a national accreditation program for breast centers late last year. We formed a governing board of 30 members, quite multidisciplinary. We are governed then by the NAPBC board, but we're administered by the American College of Surgeons. It's quite a comprehensive program, and after many, probably 10 or 15 iterations, we arrived at 27 standards, 17 processes of care, but 27 standards, and those standards are the ones that were all met by the center here. In summary, we think that the NAPBC is a program which was really needed. It's going to raise the standard bar. It's going to provide state-of-the-art evaluation and management for patients with diseases of the breast. This center would not have been one of the first centers had they not been poised to do it.
We are thrilled to have this program. This is an established program, and I know that the treatment of breast cancer is really a moving target. It requires a multidisciplinary team approach. It requires specialized knowledge in different fields, and anybody who comes to have their treatment here can be sure that they will be seeing a professional with that requisite specialized training behind them. Patients benefit from this across the board. Number one, the requirements for accreditation involve modern breast cancer care. And so all of those things are applied in the treatment for these patients. So they don't have to wonder if they're getting the best thing or the newest thing or the latest and greatest. They can be sure that they are.
Just about a year ago, I was diagnosed with cancer. I had found a lump and had gone in and got it checked. And it was a Friday morning, and I was on my way to school, and they called me and told me I had cancer. So immediately, Chris called Dr. Tony Casolaro, who is the Redskins doctor, who knows Dr. Akbari. Sorry, and got me an appointment with her 8 o'clock on Monday morning. I met Dr. Akbari and knew within the first minute that she was going to be my doctor. She walked in, she's amazing, and I felt like I couldn't be in better hands. I think all in all, I've been to a doctor over 90 times in the last 11 months. So you have to like them. You have to love them. I mean, you know, I think I know everyone in their office, and I know them all, and I couldn't have gotten better care. I just couldn't have. There couldn't be a better place to be than here. I mean, I can't compare it, but I feel that there couldn't be.
A lot of the doctor's appointments I went to, everything happened so fast, and, you know, you're kind of blown away. These guys did a great job of explaining, taking notes, telling us what was going to happen, telling us what to expect, what our options were, really explaining, you know, to a person who's never had this or doesn't understand kind of what to expect and what they're going to go through. And for me as a son, that was great to know that my mom was receiving that care and to know that she was in good hands and to just, it was a trust level. It's something that when you meet someone, you just have that level of trust. And to know that your loved one is getting that care was amazing.
On behalf of the National Accreditation Program for Breast Center Board and the American College of Surgeons, I'd like to congratulate you all for this exemplary program, and would actually like to present you with a certificate right now. So this says the National Accreditation Program for Breast Centers awards this certificate of accreditation to the Center for Breast Health, Virginia Hospital Center, Arlington, Virginia, for 3-year full accreditation. Congratulations, and this is the top of the line. We do have other certificates that have contingencies, and some of them are deferred, but this is the best you can do, and so you should be proud.
When a woman is diagnosed with breast cancer, she wants to put her care in the hands of people she can trust. The Center for Breast Health at Virginia Hospital Center is honored to serve our breast cancer patients and their families with the highest quality of care they deserve from an NAPBC accredited breast center they can trust.